Did you know that your bones might be weakening even without you knowing it? So if you want strong bones throughout your life, you've come to the right place. Hi, I'm Dr. Jake. My fitness facts videos are based on peer-reviewed research and intended to dispel myths and half-truths that flood social media, but also to provide you with sound facts that can help you to become healthier. For example, true or false, calcium supplements alone can reverse osteoporosis. Leave your answer in the comments section and keep watching the video to find out. Like termites eating away at a house, osteoporosis could now be weakening your bones, like it has for millions of people, leaving them susceptible to fractures, a number of which is likely to double from 2018 to 2050. The good news is that unlike lumber, your bones are living tissue that's constantly being remodeled by bone cells that break bone tissue down and other cells that lay down new tissue, keeping your bones healthy and strong. However, when osteoclasts, the cells that break down bone tissue, outwork the osteoblasts, the cells that build it up, bone mineral density or the strength of the bones declines to a point that leaves them susceptible to fractures. And that's osteoporosis. In the U.S., osteoporosis inflicts 18% of the women and about 4% of the men aged 50 and above. Yes, it's not just a woman's disease, and both of those numbers increase with age. Worldwide, the numbers are similar, with osteoporosis found about 6% of men and 21% of women in the same age range. Fractures from osteoporosis can be devastating since they lead to chronic pain in the neck, back, and other joints, loss of mobility and independence, a significant decline in the quality of life, and in extreme cases, severe complications that can lead to increased healthcare costs and a shortened life. And unfortunately, the number of hip fractures over the next couple of decades are projected to increase, which is why it's important to learn as much as you can about osteoporosis to prevent it from happening. On a positive note, one study found that Canada had the lowest risk of osteoporosis, so maybe strong bones come from drinking maple syrup. Just joking about the maple syrup, but the rest is true. Go Canada. But what's not a joke is that recent studies show the prevalence of osteoporosis is increasing. Before I go into the why, let's talk about the inner workings of your bones. The word skeleton comes from the Greek for dried up, but rather than dry, your bones are living structures that can change shape and density as old bone tissue is removed and new tissue is laid down in a process referred to as bone remodeling. This remodeling is accomplished with the help of three main bone cells: osteoclasts, osteoblasts, and osteocytes. The osteoclasts remove or really resorb older damaged bone tissue, while the osteoblasts deposit new bone tissue. Meanwhile, the osteocytes coordinate the process as they respond to hormones like parathyroid hormone, estrogen, calcitonin, growth hormone, and others. These hormones influence the activity of bone cells and help establish the calcium and phosphate levels in the bone. And osteocytes are also activated by mechanical stress, like what happens during exercise when that strain is transferred into intercellular signals that influence the activity of the osteoclasts and osteoblasts. Interesting, as osteoblasts do their job, they secrete cytokines that stimulate the formation of osteoclasts. Likewise, osteoclasts release chemicals that draw osteoblasts to the area and also helps activate them. In other words, these two opposing cells work together to help keep each other in balance. And go ahead and post any questions you have about bones or osteoporosis in the comment section. You may be wondering, if osteoporosis is so bad, why do we have osteoclasts that break down bone tissue? For one, it's important for bone health to replace old bone tissue with new, stronger tissue that can adapt to mechanical stress. This is half of what's known as Wolff's Law, which states that if a bone is subjected to an increased load or stress, it will remodel itself to become stronger. But your bones also serve as calcium storage centers, which give up their calcium when the cells of the body, which can't function without calcium, begin to run low. For example, your muscles can't contract without calcium, and if you're not getting enough calcium from your diet, the body resorts to getting the calcium from your bones that your muscles need. But with a healthy diet and regular physical activity, bone remodeling operates in a balance between bone resorption, when osteoclasts are breaking bone down, and osteoblasts doing their bone building thing. So you can see that diet and exercise play key roles in keeping your bones strong, but the timing of bone building is also key. The most critical time to develop strong bones is unfortunately the teenage years, when stubbornness seems to prevail. At birth, some of your bones are really just soft cartilage that over time turn to bone through ossification. Importantly, long bones like your femur retain a sliver of cartilage at both ends where bone length continues to increase. These areas are referred to as growth plates. Eventually, the cartilage in the growth plates is replaced with bone tissue, and the bones stop growing, which happens in the late teens and early 20s. But after that, the bones continue to grow in density and strength until about age 25 or 30. At this point, the bones have reached what's called peak bone density, thanks to the osteoblasts outworking the osteoclasts during the teens and early 20s. Here's the important point. At peak bone density, your bones are strong as they'll ever be, because after about age 30, the bone remodeling process reverses itself, with osteoclasts being more active than osteoblasts. Therefore, the higher peak bone density gets, the lower the risk of developing bone problems and osteoporosis later in life. And a high peak bone density isn't going to happen unless the teens and 20s are full of physical activity and healthy calcium-rich diets. In fact, it's estimated that a 10% increase in peak bone density reduces the risk for osteoporosis by 50% and delays its onset by 13 years. So it's critical to develop a high peak bone density during the teens and 20s, because after about age 30, bone density begins to go down. And for the most part, this decline can't be reversed. If you're no longer a teenager, don't despair. There are things you can do and not do to slow down bone loss. For example, being physically inactive will make it go down at a greater rate. This is the other half of Wolff's Law, which says if a bone doesn't experience stress, it will become weaker and less dense over time. So stress and strengthen your bones with weight-bearing and resistance exercises. And then supply your bones with all the calcium they need through a healthy diet and, if necessary, a supplement. And no, a calcium supplement alone isn't enough to prevent osteoporosis. Give yourself a point. Since the roles of exercise and diet are so critical in preventing osteoporosis, I'm going to cover those in greater detail in other videos. But wait, there's more. Cigarette smoking and alcohol abuse can also increase the decline of bone density, and avoiding them can reduce bone loss by 20 to 30%. Overall, the amount of bone density that doing these things will help retain differs between people, even with similar lifestyles, because there's a significant genetic component to bone loss that you can't do anything about. But in general, the research shows that doing the things I mentioned reduces the risk for osteoporosis by 30 to 50%, which is great, but it's not a complete prevention, which is rare and would require medication. But that may be part of the solution, so check with your doctor. But if you do or don't need medication, taking charge of your bone health by doing the things that I mentioned will not just strengthen your bones, but lower your risk for many diseases and all-cause mortality. To learn more, watch my next videos on who's most at risk to develop osteoporosis and how do you know if you have osteoporosis. If you enjoyed my video, click subscribe and like. Thanks. And as always, my answers come from peer-reviewed research.